Welcome. I am Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I will focus on the articles that our Editor-in-Chief, Dr. William Lanier, has selected as Editor's Choice and Highlights for the April 2014 edition of our journal. This month's Editor's Choice is the commentary, What is Ahead for Mayo Clinic? By Dr. John Noseworthy, who is the President and Chief Executive Officer of Mayo Clinic. This commentary is part of our sesquicentennial article series celebrating 150 years of patient-centered care at Mayo Clinic. Dr. Noseworthy discusses how the commitment of all Mayo Clinic employees to our primary value, which is that the needs of the patient come first, plays a key role in ensuring that Mayo Clinic remains the most trusted name in healthcare. One of this month's featured highlights is the editorial Melanoma Resistance, a Bright Future for Academicians and Challenge for Patient Advocates by Dr. Andrei Slominski from the University of Tennessee in Memphis, Tennessee. Dr. Slominski discusses how studying similarities between the mechanisms that protect the fetus from an immune response by the mother and the mechanisms that allow metastatic melanoma to evade host responses may help researchers find new ways to treat melanoma. This editorial accompanies two review articles in our April issue. First, Immunomodulatory Effects of Sex Hormones, Requirements for Pregnancy and Relevance in Melanoma by Dr. Elizabeth Eninga and colleagues from Mayo Clinic in Rochester, Minnesota, and from Oregon Health and Science University in Portland, Oregon. And second, Latest Advances in Chemotherapeutic, Targeted, and Immune Approaches in the Treatment of Metastatic Melanoma by Dr. Stashil Shah from Beaumont Health System in Royal Oak, Michigan, and Dr. Roxana Dronka from Mayo Clinic in Rochester. The second featured highlight in this month's issue is the editorial Inflammatory Neuropathy, a potentially treatable etiology for a subset of perioperative neuropathies by Dr. Marian Mark Warner from Mayo Clinic in Rochester, Minnesota. The editorialists describe the perplexing and difficult challenge posed to anesthesiologists, surgeons, neurologists, and plaintiff lawyers by the many perioperative neuropathies that have no treatable etiology. This editorial accompanies the original article Ipsilateral Inflammatory Neuropathy After Hip Surgery by Dr. Rupal Laughlin and colleagues from Mayo Clinic in Rochester, Minnesota. The third featured highlight in the April 2014 issue of Mayo Clinic Proceedings is the editorial Opioid Overdose, When Good Drugs Break Bad by Dr. Keith Berg from Mayo Clinic in Rochester, Minnesota. Dr. Berg points out that celebrity deaths are only one manifestation of an ongoing population-wide epidemic. Although opioids can bring great benefits to patients, their misuse can result in tragic consequences. This editorial accompanies the original article Epidemiology of Emergency Department Visits for Opioid Overdose, a population-based study by Dr. Kohei Hasegawa and colleagues from Harvard Medical School in Boston, Massachusetts, and the Harvard Interfaculty Initiative in Cambridge, Massachusetts. Our new, online-only Mayo Clinic Proceedings Legacy section will feature Dr. Udaya Prakash, who was Editor-in-Chief of Mayo Clinic Proceedings from 1994 to 1998. There are also notes on two historic Proceedings articles from 1938, on oxygen therapy and aviation by Drs. Loveless and Bulbulian. This month's contribution to our ongoing symposium on regenerative medicine entitled Targets of Immune Regeneration in Rheumatoid Arthritis was authored by Dr. Philip Hohenzinner and colleagues from Stanford University School of Medicine in Stanford, California. This article and the concise review, Breast Density and Breast Cancer Risk, a Practical Review, by Dr. Amy Wang and colleagues from Mayo Clinic in Rochester, Minnesota, provide teaching exercises for which you can receive up to 1 hour of CME credit if you complete the appropriate documentation. Also featured on the cover page of our April 2014 print issue are the following articles: the commentary The questionable benefits of exchanging saturated fat with polyunsaturated fat by Dr. Uffe Ravenscoff from Lund, Sweden, and colleagues from several national and international healthcare institutions, and the original article, Natural Disasters and Myocardial Infarction, the 6 years after Hurricane Katrina, by Dr. Matthew Peters from Tulane University Health Science Center and colleagues from several healthcare institutions in New Orleans, Louisiana. Video interviews are available with authors of most of the articles mentioned in this recording and some others as well. These interviews can be found on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. Check out our new interactive Path to Patient feature, which is curated by my associate editor colleague Dr. Lori Erickson from the Department of Laboratory Medicine and Pathology at Mayo Clinic. This month, we're featuring an interesting liver specimen. Also on the website, our series entitled Editorial Board and Staff this month features Dr. David Ballard, an epidemiologist from Baylor, Scott & White in Dallas, Texas, who has been our section editor for healthcare policy since 2008. Dr. William Lanier, editor-in-chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and the other outstanding articles in the April 2014 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. As a preview, the next issue of Mayo Clinic Proceedings, which will go live on our website on May 2nd, 2014, will contain articles entitled Long-Term Use of Zolpidem Increases the Risk of Major Injury, a population-based cohort study, our treatment approach, chronic hepatitis C virus, and contemporary strategies in the diagnosis and management of heart failure. In the meantime, you can watch videos related to our journal content on our YouTube channel. You can also follow us on Twitter and like us on Facebook to stay up to date on online first publications and on breaking news related to our journal. Direct links to our YouTube, Facebook, and Twitter presences can be found in the upper right-hand corner of our homepage. Recording on yet another Minnesota day with a winter weather advisory, I remain yours until next month when it will be spring, at least nominally.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.